try to make every effort to include the latest scientific studies. Please note, though, that research is constantly changing, and one clinical trial cannot always cover diverse bodies and communities. Individual responses to foods, herbs, supplements, and treatments may vary based on genetics, environment, and other factors. Even solid clinical trials and studies tend to have an agenda or underlying bias, and despite the best intentions and efforts of researchers, the scope and purpose of scientific research will always be somewhat limited by factors such as funding, ethics, and logistical constraints. Relying on a single expert or source can be risky, as errors and biases can occur. It's best to verify information from multiple sources before accepting it at face value. If you wish to deep dive into the topic, you can check on my references posted in the description box below.
1. May be useful for clinical management and treatment of infertility in men. In a 2010 controlled clinical trial on 75 normal, healthy, fertile men and 75 men undergoing infertility screening, ashwagandha treatment effectively lowered oxidative stress and improved semen quality indicators in infertile men. Also, in a clinical trial on 180 infertile men published in the Journal of Ethnopharmacology in August 2013, 5 grams of ashwagandha root powder daily for 3 months normalized the levels of various substances in seminal plasma and improved semen quality. Biochemistry in the blood also showed improvement after therapy. According to the authors of the study, ashwagandha may be used as an empirical therapy for clinical management and treatment of infertility. And in a pilot study published in November 2013, 46 men with low sperm count were equally divided into 2 groups: ashwagandha root extract, 675 milligrams per day in 3 doses for 90 days, and placebo. After 90 days, the ashwagandha group showed significant improvements: a 167% increase in sperm count, 53% increase in semen volume, and 57% increase in sperm motility. These improvements were minimal in the placebo group. 2. May enhance exercise and athletic performance. In a 2010 study, researchers evaluated the effects of ashwagandha and arjuna, alone and combined, on various exercise-related factors in humans. 40 healthy individuals participated, receiving either ashwagandha, arjuna, both, or a placebo for 8 weeks. The herbs were given in capsule form at a dosage of 500 milligrams per day. Results showed that ashwagandha increased speed, power, and maximum oxygen consumption. Arjuna increased maximum oxygen consumption and reduced resting systolic blood pressure. The combination of both herbs showed improvement in all parameters except for balance and diastolic blood pressure. In another study on 40 elite Indian cyclists published in 2012, taking 500 milligrams of ashwagandha capsules twice daily for 8 weeks resulted in significant improvements in cardiorespiratory endurance. This suggests that ashwagandha has the potential to enhance athletic performance. Moreover, in a prospective, double-blind, randomized, and placebo-controlled study on 50 healthy athletic adults published in 2015, taking ashwagandha for 12 weeks resulted in significant improvements in cardiorespiratory endurance and quality of life. 3. May help increase testosterone and muscle mass and strength. In a 2012 study, 18 healthy volunteers took ashwagandha capsules with increasing doses over 30 days: 750 milligrams per day for 10 days, 1,000 milligrams per day for the next 10 days, and 1,250 milligrams per day for the final 10 days. Almost all participants tolerated ashwagandha well, except one who experienced increased appetite, libido, and hallucinogenic effects and was withdrawn. 6 subjects reported improved sleep quality, no adverse effects on organ function were observed, muscle strength increased, and there was a significant reduction in total and LDL cholesterol. There was also a trend of decreasing total body fat percentage. And in a double-blind study published in 2015, 57 men new to resistance training were split into 2 groups. The treatment group took 300 milligrams of ashwagandha root extract twice daily, while the control group had starch placebos. Both groups underwent resistance training, and measurements were taken at the beginning and end of the study. After 8 weeks, the ashwagandha group showed significantly greater increases in muscle strength for bench press and leg extension exercises compared to the placebo group. Muscle size increased notably in the arms and chest for the ashwagandha group. Additionally, the ashwagandha group had less exercise-induced muscle damage, increased testosterone levels, and a greater decrease in body fat percentage compared to the placebo group. Furthermore, in a randomized controlled trial published in 2018, 38 recreationally active men were randomly assigned to receive either a placebo or sensoril 500 milligrams per day. Sensoril is a standardized aqueous extract of the roots and leaves of ashwagandha. The participants maintained their regular diet and followed a specific resistance training program, 4 days per week. After 12 weeks, the sensoril group showed significantly greater gains in squat and bench press strength compared to the placebo. Changes in body composition favored sensoril, particularly in the android-gynoid ratio. Only the sensoril group demonstrated improvements in squat power, bench press power, cycling performance, and perceived recovery scores. The authors of the study concluded that 500 milligrams dose of Sensoril improved upper and lower body strength, supported favorable body mass distribution, and was well tolerated during a 12-week resistance training period. 4. May improve memory in people with cognitive dysfunction. In an 8-week, double-blind, placebo-controlled study on 53 individuals diagnosed with bipolar disorder published in 2013, adding 500 milligrams per day of ashwagandha to the regular medications of the participants enhanced auditory verbal working memory, reaction time, and social cognition. And in a 2017 randomized, double-blind, placebo-controlled trial with 50 participants, ashwagandha root extract, 300 milligrams twice daily, was compared to a placebo over 8 weeks. Results showed significant improvements in the ashwagandha group compared to the placebo in immediate and general memory, including logical memory, verbal paired associates, faces, and family pictures. Executive function, sustained attention, and information processing speed also improved in the ashwagandha group as measured by various cognitive tests.
By the way, before I continue, if you're new here, I'm Jera from the Philippines. Welcome to my channel where I share my knowledge and discoveries about everything related to natural health remedies and personal development gained from reading scientific journals and books written by doctors and experts. If you also have a gluttonous appetite for new knowledge, please consider subscribing. Also, you may want to check out my ebook, 40 Wrinkle Fighters Other Than Retinol, backed by scientific studies. Just click the link in the description box below for more details.
Moving on, 5. May help improve resistance towards stress. In a double-blind, randomized, placebo-controlled trial published in 2012, 64 participants experiencing chronic stress were divided into 2 groups, one receiving the ashwagandha root extract and the other a placebo. Over a 60-day period, participants took 1 capsule twice daily containing either the extract or the placebo. Regular follow-up calls ensured treatment compliance and monitored any adverse reactions. Results revealed a significant reduction in stress assessment scores for the ashwagandha group compared to the placebo group by day 60. Serum cortisol levels, a stress-related hormone, were also notably lower in the ashwagandha group. In conclusion, the study suggests that the high-concentration full-spectrum ashwagandha root extract is both safe and effective in enhancing individuals' stress resistance, ultimately improving self-assessed quality of life. 6. May help with joint pain. In a 2016 randomized, double-blind, placebo-controlled study, 60 participants with knee joint pain and discomfort were randomly assigned to receive 250 milligrams ashwagandha, 125 milligrams ashwagandha, or a placebo twice daily for 12 weeks. The researchers checked how well the treatment worked by using different tests at the beginning and after 4, 8, and 12 weeks. Both ashwagandha doses showed significant reductions in pain and swelling compared to baseline and placebo. The 250 milligrams group exhibited the earliest efficacy at 4 weeks, and all treatments were well tolerated. 7. May help with weight management in adults under chronic stress. According to a 2017 study in 52 subjects under chronic stress published in the Journal of Evidence-Based Complementary and Alternative Medicine, taking 300 milligrams of ashwagandha twice a day significantly improved stress levels, food cravings, serum cortisol, body weight, and body mass index compared to the placebo. The results of this study indicate that ashwagandha root extract may be beneficial for managing body weight in adults experiencing chronic stress. 8. May help improve sexual function in women. In a 2015 study in 50 healthy women published in the Biomed Research International, taking 300 milligrams of ashwagandha twice daily for 8 weeks significantly improved various aspects of sexual function compared to the placebo group. This included arousal, lubrication, orgasm, and overall satisfaction. 9. May help with anxiety. In a double-blind, placebo-controlled study published in 2000, researchers investigated the effectiveness of an ethanolic extract of ashwagandha in treating anxiety disorders. The study involved 39 participants, with 20 receiving the ashwagandha extract and 19 receiving a placebo. Both groups were similar in terms of demographics and clinical characteristics at the beginning. After 2 and 6 weeks, data from about 85% of participants in each group were analyzed. The results showed trends favoring the ashwagandha extract at both time points. Notably, at 6 weeks, a significantly higher percentage of patients in the ashwagandha group, 88.2%, met response criteria compared to the placebo group. The study suggests that this ashwagandha extract has potential as an anxiety-reducing treatment and warrants further investigation. 10. May be useful as an adjunct therapy to standard obsessive-compulsive disorder, OCD, treatment. In a 2016 randomized controlled trial, researchers tested to see if ashwagandha could help alongside the standard medications in improving symptoms of obsessive-compulsive disorder. 30 participants with OCD were given either ashwagandha or a placebo for 6 weeks. The results showed that those who took ashwagandha had a more significant improvement in their symptoms compared to those who took a placebo. No adverse event was reported during the trial. The study authors concluded that ashwagandha may be beneficial as a safe and effective adjunct to selective serotonin reuptake inhibitors in the treatment of obsessive-compulsive disorder. To take ashwagandha effectively, consider your purpose and the type of supplement you have. Most studies suggest taking it 2 to 3 times daily for 1 to 3 months. Starting with lower doses is safer, as side effects are more likely at higher doses. Check the supplement label and, if uncertain, consult your doctor. While generally safe, large doses can cause abdominal discomfort and diarrhea. Ashwagandha may also increase thyroid hormone levels, so those with hyperthyroidism should be cautious. Larger doses or sensitivity may lead to side effects like stomach upset, nausea, diarrhea, vomiting, bloating, anxiety, or skin allergies.
Just remember, what works for some people may not necessarily work for everyone. If you already tried it all and followed many doctors and health gurus, but nothing worked, you may find the answer by doing some digging into your genes. If you want to get to the root cause of some of your health issues, the first step is to find your problem genes. Taking personalized supplements based on your DNA may also help, and Self-Decode can help you with that. Self-Decode provides personalized health recommendations based on a combination of your DNA, labs, and environmental factors. There are just too many diets, supplements, and health hacks out there to waste your time and money on stuff that probably isn't going to work for you. So if you want to experiment in the most efficient and effective way, click on the link in the description box below to check out Self-Decode and unlock your own genetic blueprint.
If you've learned something you didn't know before watching this presentation and you appreciate the time I invested in researching, writing, and creating this presentation, please give this video a like. If you're interested in looking and feeling your best and exploring natural solutions, please consider subscribing. Thanks for watching!